Hello and welcome to our APHL Innovate session, a public health labs experience implementing SARS-CoV-2 wastewater surveillance. We very much appreciate your time and interest. My name is Jeff Bates. I'm a marketing manager at IDEXX Water. And the primary goal of the discussion today is to hear from Dr. Abidat Lawal at the Houston Health Department Laboratory about her experience implementing wastewater surveillance in her laboratory. I'll more formally introduce Dr. Lawal in just a few moments, but we wanted to start out by very quickly level setting on what wastewater surveillance is and how it's used, just in case any members of the audience aren't familiar. Then I will pass it over to Dr. Lawal, who will discuss her experience with this type of testing to date, and we'll wrap up with a quick discussion of how IDEXX has been involved in wastewater surveillance and how we can support public health labs. So again, we'll start with a very quick introduction to wastewater surveillance in case anyone attending is not familiar. And the basic concept is that SARS-CoV-2 is shed in feces and can be detected in wastewater, either in the influent of a wastewater treatment plant or when sampled from within the collection network, even at the scale of a single building. And several researchers have found that trends in the level of SARS-CoV-2 in wastewater are correlated to trends in the number of clinical cases, and that in many cases, wastewater surveillance can provide an advance warning. As you can see in the graph of the data from Amsterdam on the right-hand side of the slide here, the wastewater levels spike a few days prior to spikes in reported cases. So the theory or the concept is that wastewater can provide an additional data point on how cases are trending within a specific community. And there are a couple reasons why wastewater surveillance provides valuable data. First, it's less reliant on human behavior. Infected individuals may decide not to get a clinical test for whatever reason, but if they're contributing to the waste stream, their infection will get picked up in the wastewater data. As I mentioned, often the wastewater data is a leading indicator, and it's also extremely cost efficient. It's a pooled sample of an entire community. Lastly, it can be used to identify trends within a specific sewer shed or a specific neighborhood or even a specific building. So those are the different advantages of wastewater surveillance, but I know a lot of people are interested in the practical application of this testing. How is this data being used to inform public health decisions? And we've seen a handful of different ways that this data is being leveraged. The first and most common, and probably the simplest, is by making the data publicly available via a dashboard. And for me personally, my opinion is that this is tremendously valuable to the public. Actually, my community, my town tests wastewater, and I look at the results often, and they're a factor in my decision making in terms of the level of risk I'm taking on some of those minor decisions. You know, would I go to the grocery store or try to make do with what I have on hand, or do I pop into a bodega to grab something versus going to the supermarket? So I really believe that these dashboards are extremely valuable, and many communities across the globe have implemented them. Additionally, we're seeing a lot of this testing being done at the facility level, especially within college dormitories, but also within correctional facilities or at nursing homes. And we've also seen this be very successful. Outbreaks have been identified or avoided based on the wastewater data. And then there are an increasing number of communities that are using the results of this testing to do things like direct clinical testing resources or communication resources. And we've heard that in some cases, communities have even made vaccination decisions based on this data. And in Europe, we're also seeing communities use this testing to avoid locking down an entire city, but instead using the data to lock down specific neighborhoods with concerning levels of viral load. This type of testing is widespread. It's being used to make public health decisions, and we're very lucky to have Dr. Lawal here, who is working to implement wastewater surveillance at the Houston Health Department. Dr. Lawal is the APHL CDC COVID-19 Associate and Technical Lead for the Wastewater-Based Epidemiological Surveillance Project at the Houston Health Department Laboratory. She specializes in molecular assay development and validation and received a PhD in environmental toxicology from Texas Southern University, a master's in molecular pathology from Texas Tech University, and both a master's and a bachelor's degree in microbiology from the University of Ibadan in Nigeria. Abidat, thank you so much for sharing your time and expertise.
Thank you for having me, Jeff. Yeah, so I'm going to go ahead and share my experience on how we've been able to implement SARS-CoV-2, of course known as COVID-19, wastewater-based epidemiological surveillance here in the city of Houston. As Jeff has rightly said, I am based in the Houston Health Department lab, and I'm primarily responsible for making sure that we implement this surveillance testing as a form of routine testing. As we all know, this SARS-CoV-2 testing in wastewater is generally or started off being detected and used by universities to determine the level of COVID-19 virus in the environment and use that as a predictor for incidents of disease outbreak as a form of monitoring and to determine the occurrence and also monitor the trends of the infection. So basically, this is the city of Houston map located in Texas. We're in the southwest of Texas. And here, the goal of this project is primarily to implement wastewater-based epidemiological surveillance as a tool for the detection of COVID-19 outbreak in the city of Houston. And through this testing we're doing, the data we generate can now be used to determine or monitor the spread of this infection in this period of pandemic and beyond in our city, and use that to offer support to affected community. Now, in the course of doing this, the city of Houston and the Houston Health Department will be able to pinpoint and identify potentially vulnerable communities or hotspots for this COVID-19 infection. And this is based off the result from the clinical side of testing, meaning when people are sick, when they are either pre-symptomatic or even symptomatic or down with the disease, they go for testing. The results are documented by the public health, and based on this result and the data generated in the hospital, the Houston Health Department is able to generate data that can give insight to areas that are mostly affected and communities that are very vulnerable, where resources can be deployed and for quick action and for strategic planning, and also monitor these places and make sure that things are put in check and the public health of the people are safeguarded and improved. So to start a new lab, a functioning lab, which is what we are doing here, even though we have an environmental microbiology lab here, we don't do the molecular testing or test wastewater. It's primarily, drinking water and dairy. But now this is imbibed and a lot of things have to be put in place. So from our experience, there are key questions that any lab, any public health lab that is wanting to implement this, which I know is a national need now for monitoring and for prediction of occurrence, to pay attention to these 5 key things that I'm about to discuss, because this will help for successful implementation of a functioning lab and COVID-19 testing in wastewater in this public health lab that is wanting to do this. Now, the first thing is you want to ask yourself, do you have the funds? And if the funds are not currently available, are you going to be getting the fund? What type of fund? And how long will you have this fund for? Because, without the funds, you can't really do much. To set up a lab, you also know that your sample has to be coming from somewhere. For us, our target was based off clinical clusters. So the data from clinical cluster is what we use in Houston Health Department to determine the communities where the wastewater samples will be collected and tested for monitoring purpose. Also, you need to ask yourself, how frequently do you want this sample collection to be done? And you have to project your testing volume, because that will determine the number of personnel that you need to work in the lab and how much space you need and all other logistics that you need to put in place. Now, a key thing is you need to know your methodology or identify the methodology for testing. A lot of labs use different things: ultracentrifugation, use of PEG, polyethylene glycol, centrifugation, and different other methods out there. But for us, we use the membrane filtration through direct adsorption of the virus on membrane filter, and then followed by RNA extraction and all that, which I will take you through very shortly. Now, the type of methodology you choose will be based on the resources you have and the expertise of the technical expertise of the people that are in charge of your project. And you also have to think of the equipment you need: freezers, centrifuge, and every other thing, the manifold, and whatever it is that is relevant to the test you want to do. Now, also, when you finish the test, you want to start thinking ahead. What is the procedure that I need to put in place or be aware of when I want to report my data? Because at the end of the day, you don't want to do this hard work and sit on the data, because the data is of public health use and is going to determine how it will be used. So this is another thing that you want to pay attention to. And then one other thing that I think I should mention here is, when you consider your methodology, your reagents and equipment, also think about your suppliers and vendors, because that could be a big challenge. Now, in Houston, being what it is a big city, and Houston Health Department, like I said, we collect our sample from wastewater treatment plants, different facilities. We also collect samples from congregate facilities, which include nursing homes, shelters, homeless shelters, and prisons. Samples are also collected from schools, both elementary, middle, and secondary school, and also in lift stations. Now, in Houston, we have about 39 wastewater treatment plants, which is a lot. And about 51 schools have been penned down for this project, where samples are collected on a weekly basis. Now, the way it works, there are personnel that works with the Houston Health Department and people that are specialists in the wastewater treatment plants that knows how the sampling is being done. They do this, collect 5 gallons of 24-hour composite samples during 24 hours, mix it together, homogenize it, and then the aggregate is 250 ml of that is taken and kept on ice and transported to the lab. So a total of 181 samples are collected on a weekly basis and transported to the lab for testing. So this is our workflow, quite simple. The first picture shows how our samples comes into the lab in 250 ml plastic bottles, all labeled. Of course, we pay attention to the chain of custody. This is then followed by aseptic technique as soon as it comes in. You want to make sure that you wipe all your bottles with 70% ethanol. Of course, your PPE must be on. You have to apply BSL level 2 protection or PPE, and we have strict restriction because these samples are potentially COVID-19 positive. Now, the next thing, once you get your samples, keep it on ice. What we do is we spike with bovine coronavirus, which is a surrogate for SARS-CoV2. This serves as our process control. Once we spike with bovine coronavirus, we go ahead and spin down at 4,000 G for 12 minutes, and this helps us remove all the debris and prevent clogging when we get to the filtration. So once we spike, the next thing will be to add magnesium chloride, and we add magnesium chloride to help us bind all the ions that could potentially inhibit polymerase chain reaction down the lane, and also cause sedimentation and help the filtration process. So spiking, magnesium chloride addition, then followed by filtration, membrane filtration. So you have a picture right there showing how we use the 0.45 micron electronegative membrane filter. We put that in the funnel, and then we pull through the wastewater. So this filters are then rolled and put in bead-beating tubes, which are then crushed at high speed, 3000 RPM for 3 minutes. We do that in 1 minute interval, 1 minute, then we chill it and then spin and then crush it again and then chill it and then crush it again and chill it. And the reason for this is our target is RNA. We don't want to degrade our ribonucleic acid. Once this is done, the virus that is adsorbed onto the filter paper after bead beating would have been released into a lysis buffer. So I missed that step. Once we roll it into the bead beating, we have the lysis buffer and we bead beat with lysis buffer that we're going to use for the RNA extraction in the tube. So the virus is released into the tube along with the teased membrane filter. Then we proceed to RNA extraction, ribonucleic acid extraction. So we use the Perkinamyl K-Magic to do this because it's high throughput. And we took the benefit of this because we already have about 4 of these for the clinical testing for COVID-19. So that was a saving grace for us to be able to jumpstart the process. Then the next thing we do is we detect our SARS-CoV-2 virus in our sample using the Quant Studio, and the detection we use the real-time quantitative PCR, and the reagent we use is IDEXX kit. So the IDEXX kit has got in it the primer and probe, which is the N1, N2 gene for the primer probe, similar to the sequence provided by CDC. And this was why we chose the IDEXX kit. We don't want to have a problem with backlog or back order or competition. Everything comes in a kit. It's got the positive control in it. It's got the internal control in it. And you have the primer and probe as well as the master mix all in one kit. And I find it extremely comfortable. I find it, very easy to use, and it gives me reproducible results. And that's why I'm here today partnering with IDEX. I'm so proud of their product. So this is the IDEX kit I've been talking about, and this is how it looks. And like I said, the SARS-CoV-2 molecular targets that we are identifying for the coronavirus is the N1 and N2, and we use the ATCC RNA standard for our calibrator for the qPCR, because we do a quantitative test, not qualitative. Now, the good thing about the ATCC standard is that it's able to, you can use the calibrator for different targets, either for ORF or E, a gene, the envelope gene, or the spike gene, or the N. So we use it for N, and it works beautifully well with the IDEX kit. Now, I decided to just show, even though we are still in the validation phase, we did some kind of pilot testing, which is part of our validation testing, to show that the IDEX kit that we are using proves the performance of our assay, and that our protocol for this SARS-CoV-2 testing in wastewater works well. So we do have collaborators, and what we did was collect sample from the wastewater treatment plant, 12 different wastewater treatment plants. We tested it with going through all the workflow that I've mentioned, and then we compared the gene copy number of N1, N2 that we found in these 12 water treatment plant samples with that of our collaborators that we use as our validation comparison. And as you see in my data, we at the HHD replicate 1 and 2, we were able to detect higher copy numbers of N1 and N2 gene in all the wastewater that we tested compared to our collaborators that are helping with the validation. And another thing is that our CT values were very pretty. You can see that it's very, very tight. And this wonders is just, taking place with the ease that the IDEX kit provides, because I tell you, if there is anything I have learned in this process, it is the bottleneck through supply chain. And a lot of companies with other stuff, and we just keep getting delays and delays because everybody's wanting the same reagents, the same equipment, the same material all at the same time. So we opted for IDEX because everything comes in one kit, and it comes in on time. And more importantly, when I was fine-tuning the protocol, IDEX was by me, with me, and they're still with me, working with me, and I'm very grateful for them. So lesson learned, Like I said, there is supply chain bottleneck, so you need to plan in advance, way well in advance. There is laboratory methodology, your choice of laboratory methodology, pay attention to that. We chose the membrane filtration because we already have that. We chose bovine coronavirus, but what we learned in the process is that bovine coronavirus is not stable. So if you're using bovine coronavirus vaccine and you resuspend it as your process control spike, please make sure you store it as -20 degrees and always use freshly prepared resuspension from -20 for every single spike. Because what we discover is when you keep it at 4 degrees, after 48 to 72 hours, the number of copies that you detect goes down. We did a pilot experiment and we saw that after about 2 weeks, we saw about 5-fold less copy number detection for bovine coronavirus. So that is very, very important. Same thing applies to the SARS standard. You have to make sure that you minimize the free store cycle as much as you can, if possible, aliquot, and then use it only once, and store at appropriate temperature, -70 for the standards. For IDEXX kits, I tested that. I tried to do about 6 free store cycles and it still works very well at the maximum efficiency. I compared it to other products and that was why I opted for IDEXX. So the third one is staffing needs. There is need for personnel. This method we chose involve a lot of hands-on. So you always need people that have the right training, and you need the time to train the people who, if they are not trained, to be able to do this, because it involves a lot of hands-on. We try to, introduce the Q-Magic, which is eye therapeutics. We use the journals as liquid handler when we saw that we were being slowed down at the qPCR step. Plus, there is shortage of tips as well. So automation helps as well to supplement staffing needs. But yes, you need laboratory personnel. Laboratory space is a big one for us because this is a new test, and a big concern that you don't want to have is contamination issue. So you have to compartmentalize your pre-PCR protocol, your sample process, and your post-PCR spaces. So this is like 3 different laboratory spaces, and you have to make room for this if you don't want to run into any big challenge of contamination that could potentially shut down the lab, of having positive, false positive. So I think my next slide will be to just acknowledge my team members. I'm so very grateful for this opportunity to work with great environmental microbiology lab team here at Houston Health Department. I have the support of Dr. Larry Ziegler, the lab director, Dr. Roger Seeley, the lab manager, and my the molecular diagnostic lab supervisor, Ricardo, because he has been very, very helpful, because we have the functioning clinical lab. We're able to borrow a lot of items while we were working before our own stuff coming, which was delayed for about 6 to 7 months. And my amazing supervisor, Jennifer Mayers, I'm grateful. And my team, Tuk, Mohammed, Bhavna, Valerie, Dr. Aidari is amazing, and Mohammed, they do a lot of ethic work, as well as Keisha and Simon. I say thank you to everybody, and more importantly, thank you, IDEXX, for this collaboration.
Thank you for sharing your time and your expertise, Dr. Lawal. This is I know you're extremely busy, along with the whole team, getting this testing going at the Houston Health Department. So we really appreciate you taking time out of your day to speak.
You're welcome. It's my pleasure, Jeff.
So we just wanted to finish up by saying a few words about the IDEXX test and how IDEXX has approached this type of testing, and really how we can support public health labs. So I'll just cover 3 very quick points, and then we will take questions. So the first thing to cover is that IDEXX Water has developed both reagents, as Dr. Lawal mentioned, as well as an end-to-end procedure that's now being used by labs really around the world. And we're happy to describe the test in more detail to anyone who's interested. But for this audience, we thought it might be more important to highlight that we focused on developing a test that delivers reliable public health data. We haven't introduced IDEXX, but many of you know that IDEXX has been developing tests that are used to make public health decisions for years, and we really know what's required from a test to enable to deliver data that can be used to confidently make public health decisions. Unfortunately, as I mentioned, we don't have time to go into too much detail here, but in the case of wastewater surveillance specifically, a test and a procedure that is consistent, easy to use, and available is going to produce data that can be used confidently to make public health decisions. And Dr. Lawal spoke to that a little bit. So again, happy to discuss in more detail, but our experience in the public health domain has really informed a lot of the decisions that we made as we developed this test. And just to go into a little bit more detail on ease of use, one of the reasons we think it's so important really has to do with ease of adoption. We believe that ease of adoption is important for a couple of reasons. And one is simply based on the urgency of the situation. We're in a global pandemic, and if this data can be useful, we want to start delivering the data to public health entities as soon as possible. And second, we wanted wastewater surveillance to be easy to adopt for public health labs specifically. And this is something that the CDC has discussed in detail. But many of the labs that started out doing wastewater surveillance were academic laboratories, and certainly we owe them a debt of gratitude for advancing this field so quickly. It's been truly amazing. But we've spoken with a number of academic laboratories, and very few, if any of them, are interested in ongoing routine monitoring. They want to continue to drive the science forward, experiment, and work on the bleeding edge of this field. So there's general agreement that public health labs are better suited for routine monitoring, that they have the quality systems in place to gather data that is consistent and most usable for public health decisions. But there's really a gap here. Many methods today are described in literature by academic laboratories, but it can be difficult for public health labs to adopt those methods. We've worked with laboratories that have tried to adapt methods from the literature, and it's simply complicated. As you can see here, it's very much a do-it-yourself process where it's up to the lab to source all the different materials, sometimes interpret what can be vague procedural steps, and it's on the adopting laboratory to validate the method that may have only been used in one location previously. And that's where we really feel that IDEXX can help. We've validated an end-to-end process in wastewater samples from across the country, and we lay out the process in very simple and detailed procedural steps in our literature. We also offer technical support and of course are happy to engage on PCR technique, quality parameters, wastewater surveillance in general, since we've been working with customers from around the world on this subject for several months at this point. Just to give a quick example of the level of detail that we provide, we can look at all the controls required or recommended for this type of testing, which are listed in the rows of this table here, and of course Dr. Lawal mentioned it in her discussion as well. And really, there are several decisions that need to be made on these controls. As you get into things like matrix recovery control, as Dr. Lawal mentioned, or human normalization controls, the field really hasn't yet aligned on which materials are best to use. But that's really where IDEXX can be a help and support. We've validated at least one material for each type of control in samples from all over the country. We either include the material required in our kit, or we provide you with a catalog number of the material that we validated, or the material is endogenous, as is the case with the human normalization control. And we include the primer design as well as a protocol for how to create a target mix, as well as an easy to follow protocol for each of the materials and how to use them in your testing. And again, our R&D team is very happy to discuss any of these controls with you and your team. The team, again, has done a lot of validation work around these different controls and can discuss in detail the different materials and how they work, as Dr. Lawal mentioned, with regards to stability and other factors. So that's just an example of the type of support we provide. And And that's really where we want to wrap up. I hope the discussion has given you a better sense of how public health labs can be involved in wastewater surveillance and how IDEXX can support your lab adopting this type of testing. And with that, we will take any questions. Please enter them into the question and answer pane, and we will make sure we get you a response.